Welcome to Coronario eHealth platform and services. Its purpose is to monitor population that is sensitive to COVID-19 or other similar infections. A mature solution is offered. It has been developed in Microsoft Xamarin tool, thus it can be deployed as an Android, iOS, tablet, laptop or desktop application. Azure Cloud Services are used for storage of the information exchanged. It can be used for remote monitoring of potentially infected persons, either at a primary level or during rehabilitation after recovery. Emphasis is given on sensitive populations such as diabetics, people with heart problems, transplanted, etc. The selection of the appropriate treatment is assisted by multiple sensory information. Any diagnosis at the present version has to be confirmed by the supervisor, doctor, but artificial intelligence tools can easily be plugged in. If they are medically certified, they can also generate by themselves the diagnosis. However, non-life critical alerts can be automatically generated in this version. The medical protocols followed are automatically updated in terms of sensors used, sampling protocols followed, and the questions included in the questionnaire that the user has to answer. Advanced techniques are also employed, including sound processing of cough or breath, image processing, etc. The advantages of the proposed solution include reduction in the congestion of primary healthcare units, unified treatment rules that are applied to all patients, the protection of the patient privacy is guaranteed. The system will also be used after patient recovery when he returns home after his hospitalization, gathering critical statistical information about the health of people that have been infected from COVID-19. The system is open to extensions in order to support other similar infections, different mobile and cloud platforms, and different regional settings, including language of the user interface and authentication methods. The architecture of the developed platform includes the following modules: the Coronario mobile application on the user side, the eHealth medical sensor infrastructure, including several sensors such as temperature, blood pressure, body position, glucose meter, respiratory sensors, galvanic skin response, or even more advanced sensors like ECG, electrocardiographs, and electromyographs. The cloud that is used for storage of the information exchanged, and the supervisor doctor accesses this information through the developed Coronario Supervisor application. An artificial intelligence tool can plug in there in future versions. The end user is authenticated through the Coronario mobile application. He selects the language of the user interface and downloads from the cloud the latest medical protocol that will be followed, as well as the sensor sampling strategy that has to be followed as well, and any other messages that are sent by the supervisor. The end user can fill a questionnaire describing his symptoms, record and analyze the sound of his cough and his breath, and upload this information to the cloud. Any messages from the supervisor instructions on how to do the required examinations through the available sensors are also displayed in the Coronario mobile application. Now let's have a look on the implementation details. In the browser, you can see the Azure Cloud Services used. The most important are the Coronario Storage and Internet of Things Test Hub. JSON format is used for all the information stored. The sensor data are simulated using a console application. you can see in this console window what kind of information is scheduled to be sent to the cloud. If we like to stop sending this information from the sensors, we can press any key to close this window, and then we can view how the supervisor can access the data using the Coronario Supervisor application. This is the window of this application. First thing, he can connect to the cloud service. He can also select the language of the user interface. Now he's connected to the cloud. The user interface is selected again to be English. He can view some sensor data, as you can see here. The system parses the JSON format of the sensor data as they were stored in the cloud and displays them in a more readable format. He can also send a message to the end user. For example, I can type avoid lying in bed for too long, and he can send this to the cloud. This message will be downloaded later by the application used by the end user. He can also select the medical protocol, such as the one displayed here. Medical protocol 1. It is a preview of this protocol is displayed here. The full protocol can be seen here in this notepad. You can understand that this protocol defines in the first section of the questionnaire the symptoms that are included in the questionnaire. In the second section, it determines the sensors and their sampling strategy. And at the last section of the alerts, various rules can also be defined if all the conditions set are valid, then the alerts are generated. Now, in the Coronario mobile application, in the first page, the user selects the user interface language. For example, let's keep the English. The first time he enters, he may define his username. If the username is not recognized, then the system asks the user to sign up. Otherwise, if I enter some valid username and password, in the user ID, I can enter, for example, my health insurance identity. And then I can log in. I can also log into the account in the cloud. Successful authentication and successful connection is displayed here. In the next page, I can download by the cloud the alerts. For example, you can see the message I sent earlier, try to do some exercising, avoid lying in bed for too long. And I can also download the latest medical protocol. Here you can see the protocol that was shown earlier on the supervisor side. If I check the default questionnaire, a fixed questionnaire is used, as we will see later. Otherwise, the customized questionnaire defined by the downloaded medical protocol is followed. In the next page, I can give some personal information. Now you can see the customized questionnaire of symptoms as it is defined by the medical protocol. The intensity of each symptom can be described using sliders, left for low intensity, right for high intensity. If I had selected earlier the default questionnaire, this questionnaire would have been displayed. The answers here are given in a different way using checkboxes, and this has been employed as an alternative way to show how the questionnaire can be structured. In the next page, the location of the patient is determined. You can see here the coordinates and the country recognized, and using this web page we can download the coronavirus cases of this region or this country. The position of the user can also be displayed on the map. This information can be used to assess the risk of being affected by COVID-19. In the next page, a sound file can be selected that has stored either cough or breathing sound. For example, I will select a file that has stored a cough sound. This sound can be analyzed in the frequency domain, as you can see in the color canvas here. And the characteristics of the sound in this domain can be used to classify it as a symptom of COVID-19. Finally, in the last application page, you can see the sampling strategy displayed. The information sent within the medical protocol by the supervisor and was represented in JSON format is converted here in natural language, telling the user how to do the required tests using the appropriate sensors. Now, if we return back to the first page, and select Greek language, then in the following pages all the messages will be displayed in Greek. The next steps towards the final product are the following. It has to be tested in real environments such as primary healthcare units, official medical protocols have to be tested, and it has to be tested with patients that are in the rehabilitation phase. The user interface has to be made more friendly, hiding unnecessary details. Authentication methods common to all European Union countries such as EIDAS will be supported. The application has been currently developed and tested using Azure Cloud Services and Android phones. It will be extended to support other mobile and cloud platforms. It will also support different regional settings, for example, the languages of the user interface. And finally, it will also be tested for different medical cases. Thank you for your attention.